In this video, I'm going to share 4 relapse prevention strategies that you can use with almost any kind of addiction. And all of the tips that I'm going to share come straight out of the science of relapse prevention and my experience as a clinical psychologist. If you want the details, I'd suggest reading the book that I'll link in the description below. But if you're interested in the bigger picture, what I'm going to do in this video is package 4 of the most helpful concepts in that book into a song. So if you're ready for some scientific relapse prevention strategies, let's jam. Tip 1 is to increase your self-efficacy. Now, if you don't know what self-efficacy is, it's just the degree to which an individual believes in their ability to change a behavior, believing that you are able to not relapse. Self-efficacy is predictive of whether someone will relapse or not. Self-efficacy is predictive of whether someone will relapse or not. You need to work on ways to increase your self-efficacy. And the way that you can do this is by having some mastery experiences. These are just experiences in which you express your competence at some task, slowly increasing your confidence in your ability to take action, even if it's not in the domain of addiction, will actually increase the chances of you not relapsing. So go be a master at something. Tip number 2 involves intentionally pondering the negative consequences of relapsing. Now, before someone relapses, they'll have some vague idea in their mind about what the consequences will be of that relapse. But because our negative experiences of us relapsing often comes with guilt, shame around what was done when we did relapse, we try to push the thoughts of relapse away from our mind. And when we do that, we also push the thoughts of what the consequences will be out of our mind. So the tip here is, even though it sucks, stay with thinking about the consequences and thinking about the negative things that have happened from relapse. Stay with thinking about the consequences. Tip 3 is to stop avoiding negative emotional states. The avoidance of negative feelings has been considered one of the biggest reasons that people turn to substances in the first place. Most addictions can be traced back to trying to avoid some internal state. And even when you're not trying to avoid negative internal states, you might be turning to a substance to increase some positive state. So the actionable step you can take for this tip is to take up a meditation practice. Meditation teaches you how to be in the present moment with your emotions, thoughts, experiences, non-judgmentally. Be in the present moment. Tip number 4 involves actually listing down your coping resources. Oftentimes we relapse in high-stress situations. So actually spend time thinking about what helps you reduce stress and write those down on a paper so that you have alternatives to using the substance that helped you cope. What helps you reduce stress? What helps you? Now, outside these 4 strategies, there are many theoretical perspectives and many other strategies that you could use to help with any sort of addiction. And these tips are very broad and crude, so I would suggest a deeper read depending on the kind of addiction that you have, because there will be differences regarding that too. So I hope this helps, and if you'd like to keep jamming your way to better mental health, then I'll see you in the next video.